Neck pain, pinched nerve, how to know if you're doing the right neck exercises or stretches.
Sure.
This is very important because if you're doing the wrong one, it can make it worse.
Absolutely.
So neck pain can vary in location and intensity. It depends on your diagnosis and your age and your posture. But the common locations are, and we got them kind of
We mapped
laid
them
out here.
out.
We mapped them out. This is for a pinched nerve, but it's very common to have neck pain, of course, up in the neck itself. But then you can also, Brad, do you want to show out some?
Sure. So we have a lot of people may not be aware of this, but oftentimes there's something called referral pain. The pain refers down to the shoulder blade area. That's very common. It can come over this way onto the shoulder, as the blue tape shows. And then if it's a nerve, and it's pinched pretty bad, it's very common that it's going to go down the arm. Now, it may be in the front of the arm, not always in the back
Yeah.
like we have it here, but down the arm and down all the way to the wrist and actually up into the fingers.
So those are the common areas. And if your pain is getting worse, it's going to go further down.
Right, right.
That's pretty much a rule of thumb that can be relied
Pretty
upon.
universal.
Yeah. So like if you just have shoulder pain and it keeps referring down the arm, that shoulder pain is getting
Stop
worse.
that.
What we're looking for is that your symptoms are going to improve the farthest away,
Right.
where you're feeling. So, like if I'm getting symptoms all the way down here into the hand, what I want to see is the hand gets better first.
Yep.
Now that could be numbness or tingling or
Sure.
burning or whatever.
And you really have to be aware of it before you start your stretch. I always have patients put a number for intensity on the pain and numbness in your hand and fingers right now. They'll say a 6, and we'll do some exercises. And sometimes you have to think about it. Oh, yeah,
Yeah.
it's down to a 3 now.
As it gets better, you're going to see the pain hopefully get improve as you move up the arm. We actually have this tape so Brad can show improvement here.
Yeah.
So,
So Bob has these symptoms, and he starts to stretch his neck in a certain way. And this is what happens the next day. The pain, the blue represents where the pain or the symptoms, numbness, tingling are. And let's say it gets this much better. All of a sudden, oh, this part's gone, but it still hurts here, and maybe even a little worse up here. That's actually a good sign because it's getting better. We call it distally or farther away from the neck.
so yeah, let's say you come in and you see me and you're like this,
Yep.
and we start doing exercises, and all of a sudden you have pain down here too.
Yeah.
That's the worst sign.
Yep.
That's
And
the
get to the right exercise. It's just not
Right.
a global thing. And so let's say we get to the right exercise, and all of a sudden, voila! Oh, the arm pain is gone.
yeah, the numbness, the
But
tingling.
it hurts a little more up here, possibly. But the arm pain, the numbness, tingling is all gone.
Very good sign.
You bet.
This is-
I'm smiling as a
Yeah,
therapist.
now we're
Yeah,
happy.
you keep doing this. A lot of times it's the same stretch. Sometimes it has to be modified. And then the shoulder pain goes away, and we just have a little bit here. And then we continue. And, when it comes down to is just pain in the neck here, boy, and everything else is feeling good, that's a really good sign. You continue to work it, and eventually,
Boom, it's gone.
yeah.
Go to bobandbrad.com, go to the program section. There's other programs there, by the way.
yes.
And you'll find the one on neck pain.